Well, the managed health plans have operated predominantly in the medical space, and they have been specifically instructed by CMS that whatever they do has to be because of a medical necessity. So they believe that looking at their members is from that medical perspective, but we now know that social determinants of health really drive healthcare costs and outcomes, and unfortunately there is some healthcare disparity. And so there are amazing community providers in the aging network, in the disability network, in the affordable senior housing network, and in faith-based that have been providing social services and helping people with their social determinants of health for a long, long time. I mean, you go back to the public health model, and so you really have to have, in order, it's so exciting that CMS has recognized this, that the importance of starting to bring these silos together so that health plans now have the opportunity to partner and in many cases contract with community providers instead of trying to reinvent the wheel and figure out how to do this themselves. And so, sometimes it's difficult because you have to hold the hands of the community provider and teach them how to do claims, teach them how to report outcomes, and do all the things that health plans have to do and have to report on. So there is this going on right now where these community providers get a proposed contract from a health plan, and they're like, what do we do with this? Starting with even getting a number that allows them to even have a contract. So it's exciting stuff being done in the community. The fact that we're now bringing these together, and I would like to say that most health plans have already been operating in this space. They just don't know it. The medical side doesn't know it. Most health plans, and especially if they're sizable, they have community benefits programs. They have foundations that already have been out in the community and helping fund special programs. And so when you ask them, obviously the foundation side needs to be completely different than the medical operations. But these partnerships exist. So the only difference is in choosing which ones. And I think this is a great opportunity for plans to test things out.